There are 5 medical tests most people over 70 are told to get routinely, but which may quietly harm you more than help. As a physician who has spent years treating older adults, I can tell you something rarely said in exam rooms: not every test protects you. Some create problems that never need to exist. Every year, millions of seniors walk into clinics believing that more tests mean more safety. But modern research paints a very different picture. New data shows that up to 37% of medical tests in seniors lead to unnecessary treatments, complications, or long-term side effects. And shockingly, most people over 70 don't realize they're being routinely overtested. One test on this list, the number one test, is responsible for up to 5% of all cancer cases in the US, a burden almost equal to drinking alcohol every day. Yet it's sold as early detection. The truth is buried in science, but today, I'm pulling it into the light. As your doctor, I'm going to explain the 5 medical checkups you should avoid after 70, why they can quietly damage your health, and what safer alternatives exist. Before we begin, let me know in the comments. Where are you watching from? What's your age? Have you ever taken a test you later regretted? Your story may help someone else. Let's begin with the first checkup, one that appears gentle and harmless, but often leads to avoidable medication, fear, and side effects. Checkup number 5, bone density scan, DEXA. A bone density scan, or DEXA scan, sounds simple and safe. It's quick, painless, and widely recommended for older adults. But after age 70, this test frequently leads to unnecessary medication and anxiety. You see, bone loss is a natural part of aging. Just like wrinkles or gray hair, declining bone density happens to everyone. But because DEXA machines measure small number changes precisely, almost all seniors come out with results labeled osteopenia, a mild thinning of the bones that rarely needs treatment. Yet many seniors are immediately prescribed medications such as bisphosphonates, which come with notable risks. Jawbone deterioration, severe reflux and inflammation in the esophagus, bone pain, rare but serious fractures in unusual locations. But here's the key question: do these medications meaningfully reduce fractures in people over 70? A study of over 1,200 women in the Journal of the American Geriatrics Society found that in older adults, bisphosphonates reduced fracture risk by just 0.3% over 5 years. In other words, almost no measurable benefit. Let me share a real case. Rose, age 76, had no history of fractures, stayed active, and walked daily. After a routine visit, she was sent for a DEXA scan. It showed mild osteopenia, nothing dangerous. But she was placed on medication immediately. Within months, she developed severe reflux and jaw pain that kept her from playing piano, something she loved. We stopped the medication, supported her with vitamin D, resistance training, balance exercises, calcium-rich foods. 1 year later, not only was she healthy again, but she was performing piano recitals with a stronger gait and better balance. For most seniors, lifestyle changes are far more powerful than medication. If you have not experienced falls or fractures, consider holding off on repeated DEXA scans and medication unless there's clear clinical need. Checkup number 4, brain MRI for mild memory loss. Memory changes are frightening. When seniors begin forgetting names or misplacing items, the mind immediately jumps to Alzheimer's or dementia. Many doctors respond by ordering a brain MRI. But here's what most people don't know. Brain MRIs rarely help with mild memory issues. In fact, the results can create far more anxiety than answers. MRIs often show normal age-related shrinkage, harmless white matter spots, small changes in blood vessels, tiny cysts. These changes look alarming but are expected after 70. Yet once the report uses words like abnormality or lesion, panic begins. A 2021 neurology review of over 3,000 MRI scans in adults aged 70 to 85 found 86% showed some abnormality. Only 3% were actually treatable, but 12% were referred for invasive procedures like lumbar punctures or biopsies. This cascade of fear and overtesting often does more damage than the memory lapses themselves. One of my patients, George, age 74, came and worried about misplacing his keys. He was sharp, independent, and active. His MRI showed white matter changes, very common at his age, but he assumed this meant early dementia. He stopped driving, withdrew socially, and spiraled into anxiety. When I performed a cognitive screening, a simple, validated paper test, George was completely normal for his age. Once we explained that his MRI findings were part of healthy aging and focused instead on sleep quality, hydration, and mental exercises, his confidence returned within months. Bottom line: for mild memory concerns, a cognitive test is the proper first step. MRI is only useful when there are sudden neurological changes, seizures, rapid decline, new personality changes. In all other cases, MRI causes more fear than benefit. Checkup number 3, cardiac stress test. This is one of the most commonly overused tests in seniors. A cardiac stress test measures how the heart performs under exertion, usually with a treadmill or medication that stimulates exercise-like effects. It's meant to detect blocked arteries, but after 70, the test loses accuracy. In older adults, stress tests show false positives up to 40% of the time. This triggers angiograms, stent placements, hospital admissions, exposure to contrast dyes, potential kidney injury. A major study in JAMA Cardiology showed that over half of all stents placed after stress testing provided no health benefit in people without strong symptoms. Let me illustrate this with Raymond's story. Raymond, 75, walked daily and was active. During a checkup, he casually mentioned feeling tired on hills. Without chest pain, tightness, or breathlessness, he wasn't showing classic heart symptoms. Still, he was ordered from a stress test. The results were borderline, so he was sent for a catheterization. A mild narrowing was found, and a stent was placed unnecessarily. That night, he suffered a kidney injury from contrast dye, leading to a 6-day hospital stay. His original fatigue, caused by dehydration and irregular meals. Better alternatives: resting EKG, coronary calcium scan, blood tests, lifestyle assessment. Stress tests should be reserved for clear cardiac symptoms, not mild age-related fatigue. Checkup number 2, colonoscopy after 70. Colonoscopy is valuable earlier in life, but in older adults, the risks climb sharply. The prep alone can cause severe dehydration, kidney problems, dizziness, dangerous electrolyte changes. Sedation increases the risk of confusion, falls, heart rhythm problems, post-procedure complications. A landmark 2019 study of 1.3 million seniors showed that for every 1,000 colonoscopies after age 75, only 2 lives were saved. But 20 seniors had serious complications. That's a 10 to 1 harm-to-benefit ratio. Dana, a healthy 73-year-old, had no symptoms and had already done multiple normal colonoscopies in the past. A new doctor insisted on another one. A tiny polyp was removed, and that night, her bowel perforated. She spent 9 days in the hospital. Guidelines are clear. Stop routine colonoscopy at 75. After 70, consider non-invasive stool tests such as FIT unless symptoms appear. These tests are safe, accurate, and require no sedation. Checkup number 1, full-body CT scan. This is the most dangerous and misleading test offered to seniors. Full-body CT scans expose you to 10 to 20 millisieverts of radiation, equivalent to about 500 chest X-rays. A 2023 JAMA modeling study estimates that CT radiation now accounts for up to 5% of all cancers in the U.S. These scans detect harmless, age-related findings that trigger panic, repeat scans, PET scans, needle biopsies, surgeries. Marcus, an 80-year-old martial arts instructor, underwent a full-body scan as part of an executive health package. It showed a tiny 3 millimeters lung noodles. The biopsy caused his lung to collapse. 2 months of recovery for something that posed no actual threat. Medical societies around the world agree. Full-body CT scans should never be used in healthy adults. If you have symptoms, targeted imaging is appropriate, but scanning the entire body, just to be safe, is medically unsound. Final thoughts, doctor to patient. After 70, medicine is not about hunting for every tiny abnormality. It's about preserving mobility, independence, cognitive sharpness, confidence, quality of life. Before any test, ask, if this finds something, what will we do next? If the next step is invasive, risky, or unnecessary, reconsider. Your health is shaped far more by lifestyle, movement, nutrition, sleep, stress, than by endless tests. And now, I'd love to hear from you. Has you or a loved one ever gone through a medical procedure that wasn't actually needed? Share your experience in the comments. Your story may help others stay safe.